8 warning signs you're not drinking enough water. Dehydration is not just something that affects extreme athletes or those with gastrointestinal illnesses, but can even affect the common adult. Especially adults over 55 are even more vulnerable to dehydration as they age, their sense of thirst decreases, and they may not be aware of their body's need for fluids. Dehydration can lead to a lack of clarity in thinking, reduced energy, and a sharp decline in blood pressure that can cause dizziness and result in a fall, which may cause a bone break too. You may also experience hypoglycemic shock, a situation wherein your blood pressure is so low that your body will cease supplying blood to your brain to protect the other organs. It is extremely significant to be conscious of dehydration when you or someone you care about is ill. Everyone is aware that diarrhea and throwing up can lead to liquid loss. However, you may not be aware that a high fever can also be a risk factor. Furthermore, certain sedative drugs may induce dehydration as they limit the body's desire to consume fluids. To determine if dehydration is occurring, here are some signs and symptoms to observe. Dark urine. The lighter the color of your urine, the more hydrated your body is. According to experts, your urine should be similar in color to tap water if you are properly hydrated. On the other hand, if you notice your urine is a dark yellow or brown or has a stronger odor, it is likely a sign that you are not getting enough fluids and should drink more water right now. Thirsty. If you are 50 or older, you are likely already a bit dehydrated when you feel thirsty. Experts explain that the degree of dehydration necessary to cause thirst is higher for this age group than for younger people. Even if they don't feel thirsty, older adults should still drink water throughout the day. Try to drink at least 48 ounces of fluids daily and more if you are physically active. Sports drink, non-caffeinated sodas, flavored or sparkling water, and juices all count towards your fluid intake. Additionally, you can increase your intake with foods that contains a lot of water such as soups, watermelons, cucumbers, and more. Headache or confusion. Dehydration can lead to a decrease in blood flow, which can trigger headache, fatigue, and weakness. If you are responsible for someone who seems confused, dehydration should not be ruled out as a potential source. Medical experts point out that many things can cause confusion, such as a possible infection. However, dehydration can also be the culprit, as it can cause a decrease in blood pressure. The difference that fluids can make is often remarkable. Dry mouth. When someone is dehydrated, their saliva production is decreased. Doctors suggest that looking at the inside of the person's mouth to see if they are dehydrated. The tongue should be glossy if the person is hydrated. In case of extreme dehydration, one may even spot mouth sores, which is a sign of inadequate hydration. If such symptoms are met, start consuming water immediately or any kinds of fruit juices you would love to have. Constipation or less frequent urination. Water is beneficial for your body as it helps rid of toxins as well as keeping your digestive system functioning correctly. It is suggested that if you are drinking the recommended amount of water, you should be using the restroom every 2 or 3 hours and having regular bowel movements. If your usual pattern of using the restroom is disrupted, this may be an indication of an issue. Dizziness or fainting. Dizziness is a classic indicator of dehydration, which can be caused by a variety of ailments. When someone is dehydrated, the amount of fluid in their blood vessels is insufficient, resulting in reduced blood flow to the brain and a sensation of dizziness. It is more common to feel lightheaded when you go from a lying down position to sitting up, or when you stand up after sitting. According to medical experts, if the amount of blood going to your brain is significantly lower, you may experience a sudden darkening of your vision, which could be an indication of dehydration and potential to faint. Muscle cramps or weakness. Another symptom of dehydration is fatigue muscle or severe cramps. These cramps can be the result of electrolyte disturbances and inadequate blood supply to the muscles. They can happen when you are exercising, or you can experience severe cramping in your calf muscle while you are sleeping. According to medical experts, the pain from these cramps can be so severe that it can prevent you from sleeping. Facing such symptoms can cause you feel discomfort and might even lead to vomiting sometimes. Weakness in skin. When you are dehydrated, the skin on your body can become dry and lack luster in certain regions, such as area beneath your eyes. It will also lack the usual amount of elasticity. If you are looking after someone who is fragile, a way to tell if they are starting to become dehydrated is to lightly pinch or press the skin on their arm. Experts states that when you do this, the skin may not spring back into position as it usually would. This can be quite noticeable and can be a clear indicator of one should consume more water. Now that you know the 8 signs of dehydration, you should never ignore, and it's important to make sure you are drinking enough fluids. Try to drink at least 8 glasses of water a day and make sure you are getting enough electrolytes in your diet. If you are feeling any of these signs of dehydration, it's important to drink plenty of fluids and seek medical attention if necessary. Thank you for watching, and I hope you found this information helpful. Thank you.